स्टूडेंट्स, आज का क्लास है 12th के लिए and the name of the topic is Turner syndrome. Recently we have read what is Down syndrome and today we are going to discuss about Turner syndrome. This is again an important question of class 12th genetics. So today we are going to discuss what is Turner syndrome. So dear students, Turner syndrome actually it was observed rather discovered by Turner in 1938, and that is why this syndrome has been given the name after the scientist as Turner syndrome. Actually what happened in this syndrome, there occurs monosomy. Monosomy means there occurs a lack, an aberration, an absence of one chromosome from the diploid number. And you know that in humans the diploid number is 46 chromosomes, that is 23 pairs of chromosomes, and which equals to 46 number of chromosomes. And the formula in Turner syndrome patients is 2n minus 1. This is monosomy. That means what is the actual diploid number, which is 46 chromosomes, and there is absence of that very diploid number of one chromosome. That means if there are 46 chromosomes and one is absent, that means the patient is having only 45 chromosomes. Suppose I am saying you here that the individual has 2n, that is equal to 45, not 46 but 45 chromosomes, because there is absence of one chromosome. And chromosomes, this syndrome occurs in females, and females have chromosomes with the number 44 plus x0. 44 is the normal autosomal number of 22 chromosomal pairs, and the last one, which is sexual chromosomal pair, which might have been XX, but due to the absence of one chromosome it is only X0. Hence instead of 46 chromosomes there are only 45 chromosomes present in a Turner syndromic female. And what are the characters of Turner syndromic patient? Suppose any female which is suffering from Turner syndrome, what should be the features, or what are the characters of that very female which is suffering from this syndrome? So the females with Turner syndrome, they are sterile. That means they are not able to give birth to their young ones, and they have underdeveloped ovaries. They have not developed ovaries, but they have underdeveloped ovaries. Means ovaries are the female gonads which produce eggs in females, but when they are sterile, they have underdeveloped ovaries. That means they are not capable of producing eggs, and their ovaries remain filled with connective tissue. So they are sterile, they cannot give birth to their young ones like normal females. And the next character of these Turner syndromic females is that their breasts are underdeveloped. They have not developed breasts. They have not breasts of normal size, but they have underdeveloped size of breasts. And the third character of these Turner syndromic patients is that their uterus is small. They have small uterus in size. And next character of these females is that their fingers, they are not of that of a normal female, but they are puffy. Puffy means just like swollen and short fingers. And their next character is that they have short stature. Short stature means they have not a normal height, but their height remains always less than 5 feet. And furthermore, these females with Turner syndrome, they have webbed neck, short neck, webbed neck. and abnormal intelligence. Females with this syndrome, they don't have average or normal IQ, but their intelligence remains always abnormal. And they have also abnormalities that of cardiovascular type, and they also show hearing impairment. That means they don't hear normally, they have impairment in hearing. These were the few of the characters of a female who is suffering from Turner syndrome. Again, I may repeat, they have one less chromosome. Actually, when there is the diploid number is 46, but the females with Turner syndrome, they have 44 plus X0. That means instead of two chromosomes, sexual chromosomes, they have only one X chromosome, and so the chromosome number in such type of females is only 45, but not that of 46. So they show monosomy, that is 2n minus 1, that is one chromosome less than from that of diploid number. And their characters is they are sterile, they can't give birth to young ones, they have underdeveloped ovaries filled with connective tissue. That means no natural sexual phenomena occurs in their ovaries, production of eggs occur there, so they are not capable of producing eggs, hence they can't be mothers. And further, they have underdeveloped breasts, their breast size remains underdeveloped, and their size of uterus is small. They have puffy fingers, they have short stature, that means their length always remain less than 5 feet, and they have webbed neck, and their intelligence remains always abnormal. And they show also cardiovascular abnormalities and hearing impairment. They may not menstruate or ovulate. The females with this syndrome, they do not show menstruation. When the mechanism of production of eggs doesn't occur in their ovaries, then it is natural that they don't show menstruation. And again, when there is no production of eggs, hence secondary oocyte is not formed, hence they don't also ovulate, or they don't also show ovulation. And when the statistical data were found out in females, and it was observed that out of 3000 females, one female remains there with Turner syndrome. That is, out of 3000 females, one female is with Turner syndrome. This is the statistical data of females with Turner syndrome. That is 1 out of 3000. And in males, it is not viable. And furthermore, if these females, they can be corrected by hormonal therapy or fertility treatment, it must be highly sophisticated treatment from a highly capable these doctors. Only then the patients with this syndrome can be treated, this fatality or this syndrome can be corrected. And when we are talking about their life expectancy, so here I may tell you that the females with this Turner syndrome, they show almost normal life expectancy, but their lifespan remains slightly shorter than average life. If their hypertension or obesity will be treated in time, their expectancy of life, their lifespan can be increased. So students, this was today's class, that is Turner syndrome, which occur in females for class 12th, which is the topic out of genetic unit. Genetics. Hope you will have understood this very well. If you have any query, do please call me or message me on my number, which always lie with you. Thank you for being with me. Have a good day. Assalamu alaikum.